Ever wondered why some people struggle to breathe even with the slightest physical exertion? The answer might be hiding in a disease called pulmonary arterial hypertension, or simply PAH. PAH is a condition where the mean pressure in the pulmonary artery, the large vessel that carries blood from the heart to the lungs, is 25 millimeters of mercury or higher at rest. This elevated pressure can cause an array of symptoms and complications. A molecule called endothelin is thought to be the main culprit behind this disease, causing the arteries in the lungs to constrict and increase the blood pressure. This disease doesn't discriminate, but it does show a preference. It's more common in females and usually shows itself between the ages of 30 to 50. It's important to note that while pulmonary hypertension can develop as a result of long-term lung diseases such as chronic obstructive pulmonary disease, PAH is diagnosed in the absence of these conditions. However, certain factors can increase the risk, including HIV, cocaine use, and anorexogens like fenfluramine. Interestingly, about 10% of PAH cases are inherited, passed down from parent to child in an autosomal dominant manner. So what does this disease look like? The classic sign is progressive exertional dyspnea, a fancy term for shortness of breath that worsens with physical activity. Other possible symptoms include fainting during exercise, chest pain, and swelling in the limbs. In severe cases, bluish discoloration of the skin or cyanosis might occur. A physical examination might reveal a right ventricular heave, a loud P2 heart sound, raised jugular venous pressure with prominent A waves, or signs of tricuspid regurgitation. Now, let's talk about the management of PAH. The first step is to treat any underlying conditions with medications like anticoagulants or supplemental oxygen. Next, a procedure called acute vasodilator testing is conducted. This test is crucial to determining the appropriate management strategy. It involves administering vasodilators like intravenous epoprostenol or inhaled nitric oxide to see if the pulmonary arterial pressure decreases. If there's a positive response, the patient might receive oral calcium channel blockers. However, a negative response, which is more common, leads to different treatment options. These include prostacyclin analogues like treprostinil and iloprost, endothelin receptor antagonists like bosentan and ambrisentan, or phosphodiesterase inhibitors like sildenafil. Lastly, for patients with worsening symptoms, a heart-lung transplant may be considered. In summary, pulmonary arterial hypertension is a complex disease that affects the pulmonary arteries, causing increased pressure and leading to various symptoms. The management of PAH involves treating underlying conditions, acute vasodilator testing, and a range of medication options. In severe cases, a heart-lung transplant may be necessary. Understanding and recognizing this disease can lead to early diagnosis and better outcomes for patients.